like she said, my name is Brian Ebersole, and I'm here not with an oral health background. I was thrown into the deep end of oral health care whenever I decided to join an organization that does community-based medical residency programs. And so what we do is we develop residency programs to train physicians to keep them in an underserved community. And we've done that in Northeast Pennsylvania for over 38 years. We have a retention rate of about 65% of our graduates stay in Northeast Pennsylvania and are immersed in our community. Many of them have come back to the area, so they may have done that departure mode where we say that they go someplace else thinking that it's much nicer, and then they come back and are actually serving in the underserved communities around Northeast Pennsylvania. The other part is that we took that model and have now immersed ourselves into community health centers and underserved communities all across the country. So what we did is we found partners who wanted to figure out, how do I get dentists and medical professionals, physicians in general and the family medicine field, how do we get them to come to our community and stay there? And we're excited because in our first graduating class, we opened up 6 centers across the country. We trained 20 residents in primary care and dental services. Out of our 20 graduates, 17 of them stayed in that community and were part of a retention package. So I'm going to share a little bit about what some of those retention opportunities looked like in those communities. But I want to use this picture kind of as an example of how did we get into this. So as we got into oral health care, we went and got a challenge grant from the Pennsylvania Department of Health. Thank you so much for those of you in the room representing that organization. It allowed us the opportunity to say we really want to do this because if we looked at our patients, what was the issue that we were seeing that we as healthcare professionals couldn't address? It was their oral health needs. Well, the unfortunate part is that 7 of 8 quarters that we worked on that grant, we had staff turnover. So we hired a dentist who actually didn't want to look in people's mouths. We hired a public health dental hygienist who really had no interest in going out and working with the Head Start program. We had people that really didn't want to figure out what it was that our community needed. And so thankfully, we had partners in the area like Lori Woods, who you're going to hear from a little bit later, who came in and helped us kind of get our feet underneath us and get things started. So if we look at this picture, this is an event that we did. It's the Fit and Fun Days. And I used the picture because I didn't realize what it was that we needed to pull together. So I'm going to start with the gentleman on the end, Anthony Perro. Came to our organization. He said, I want to be a dentist, but I don't think I'm ready to go to dental school. And we said, great, why don't you come work for us for a little bit? So we actually immersed him into things like project management, community impact, community immersion. How do we get you to feel like you're part of our team? And now what we've done is we actually helped him move down to Philadelphia to get engaged with the Temple Dental School, go through the program, and we've created a location that he can now come back to for his community rotations and a pipeline program that will actually give him a practice that's already being started and developed now when he chooses to come back to Northeast Pennsylvania. Creating something that is now going to be a 10-year process, but we think it's important to get a local person who wants to come back to the community and give us and meet our needs. Our next person is Lauren, our physician's assistant. She's one of the folks that we put out into the school settings, and so we needed her to understand and be exposed to oral health services. The next guy, Chris, is our physician. So we took our medical residency and put them in with Beth, our dental health public health dental hygienist, and they actually now go through a 2-week rotation with her and our dentist so that they're exposed to it, because we found out in our local emergency room, 40% of the people that were coming through there that were not, did not have their concerns addressed in the emergency room were actually related to oral health issues. And so now how do we get our providers to actually take notice of those things and be able to do very basics in care? And then our dental team, Beth and Donna, who are actually immersed in the community. And I think if I have to give one takeaway message that we've learned in all of the experiences, it is that the community immersion, so we always hear that word, but it's not actually about community immersion, it's about immersing the community into the individuals. And so we require that all employees, all of our staff, all of our trainees actually do 2 community service projects. They can pick what they are, but we want them to get connected and feel that strong connection back to the base. And I have to share, the rest of the players there are our local elected officials, me without a beard, and some of our partners, whether it be Geisinger Health System, who's represented there, Maternal and Family Health Services, really pulling all of them together to be part of the education of providers to get them to stay. The next thing that we did was we went around and I actually interviewed our graduates and some people that were getting and connecting to a community and deciding to stay there long term. So not just that they chose to stay there right after graduation, because we know that 75% of the people, wherever you go to school, is probably where you're going to end up, unless you have really strong roots or some kind of family pool that's going to take you back to your hometown. Well, we wanted to figure out what's going to keep you there 5 years from now. So one of the stories that we actually picked up on was in the community in New York, the community came together and said, we need a dentist. Okay, that's great. So everybody talks about the loan repayment programs. Everybody's excited about that. That's great. It's short term. It's not a long-term plan. It is going to be 3 to 5 years, and then good luck if you see their face ever again. That's just my opinion. Well, what we did is we worked with them to actually create a housing opportunity. And so instead of doing loan repayment in its typical sense, they did a small portion of loan repayment to help with the student loans, but they actually went together with the bank, a local foundation, and the health center and purchased their first home. Wow, that's going to keep you in a community. You're not going to go anywhere for 2 years, 3 years, 5 years if you are that immersed in the community. So that was one of the options that we did. In another community, we actually took and placed the practice. So we knew that we had a dentist who wanted to retire, and we worked with him over the period of about 3.5 years, and we got his practice ready to go. So whether it was getting your electronic health record together, making sure that the charts were cleaned up, making sure that the practice was ready to go, and we actually developed then a 5-year plan so that he could transition, and we created it so that he could turn over that practice. So it wasn't you're getting a new provider into a community. It wasn't just the flat-out purchase of a practice or a total gifting of the practice, because we wanted the provider to feel as though they had a sense of ownership of that community and of that population. So these are just a couple different ways, and my challenge to you as we think about how do we rethink how we retain people, it's not just about writing them a check. It's actually about what are going to be the things that they get connected to. It's those relationships. It's the personal and the financial. But as you look at where those all intersect, what are those things that everybody needs to have?